It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, we're back with our next guest, a naturopathic physician with expertise in complementary cancer care, talking about metabolic syndrome. It's Dr. Lisa Price and Shannon O'Kelly.
Dr. Price, thank you so much for joining us here on Health Talk. How are you today?
I'm great. How are you, Shannon?
I'm doing wonderful. We're going to talk a little bit today about metabolic syndrome, but you're a naturopathic physician.
I am.
And tell us about that practice and tell us about your training. And more importantly, tell us how you got interested in it.
Oh, I love that question, especially the last one. So I come to naturopathic medicine from research science. I'm a biochemist, and I came to Seattle in the early 90s, and noticed that a lot of people here were using some kind of a strange medicine called naturopathic medicine. And I thought, does this stuff really work, or is it woo-woo? And the question kept ringing in my mind, and I really wanted to know. But people were using it and consistently using it. So I actually was in the Peace Corps, and I came back from the Peace Corps, and I applied to Bastyr University in 1994, and I got accepted. And I thought that I would get out and do research, and so I waited for the NIH to come, and they didn't come. So I had to go into practice, except they did come in 2010, and when I became a National Institute of Health Research Fellow.
Oh, I see. Okay, I was going to ask what does that mean, Research Health Fellow?
Yeah, so the NIH, or the National Institute of Health, has many grants for research. And one of those grants was, I got one of those grants to look at the immunological effects of a natural product, a medicinal mushroom, on folks that were healthy, had healthy immune systems, and folks that were burdened with cancer or breast cancer. And so that's what I studied from 2005 to 2010 with the University of Minnesota, and then also Bastyr University.
Wow, interesting. You have quite a background, don't you?
I kind of do. Yeah.
Yeah. Well, I mean, I find it interesting that having a chemical background as a biochemist, and then going into the naturopathic area, that's interesting, because what you're doing in naturopath is using natural herbs and what do you want to call it?
Supplements, minerals,
right?
vitamins,
Minerals, those,
yes.
the natural products,
yes,
to provide health care,
right? To affect health. And so my curiosity was, again.
Yeah.
Does this work? I am Catholic, and so I have Catholic guilt about things that don't work. Yeah. And so I wanted to, before I even entered into a field and administered health or facilitated health, I wanted to make sure that it worked, it actually did something. And I was skeptical. Yes, I was skeptical. And so, again, my research background took me into, or allowed me to ask the question, does this work, and how does it work? And then when I had the NIH, or the National Institute of Health Fellow, the question was, does this natural product, this medicinal mushroom, work, and how does it work on immune cells? And so it incorporated my biochemical research background with this interest in health.
Interesting. Did you find out? Does it work?
Absolutely.
Wow.
And so the University of Washington Tumor Vaccine Center has been also doing research on the same product for a tumor vaccine. So, and we weren't the first to study. It's been studied for about 45 years, but we were some of the first to study it for breast cancer.
Where's the mushroom come from?
It's everywhere. It's a funny name. I'm going to tell you because I don't want it to sound woo-woo. Yeah. So I'm going to tell you the scientific name is Trametes versicolor, but the common name is turkey tail, and it's found all over the world. And if you're a hiker, if you go into the woods, you'll see it as a little mushroom shelf on logs, and it actually looks like a turkey tail. It's brown in beige stripes.
And this mushroom is pumping up your immune system.
That mushroom has some chemicals in it that stimulate your existing immune system, but there's 4 immune cells that become stimulated by this thing called a polysaccharide. And natural killer, macrophage, and CD8 cells, and some other cells. So, yep.
All right, that's Dr. Lisa Price, naturopathic physician. We're going to talk about metabolic syndrome as we continue our conversation with her next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Continuing our conversation with Dr. Lisa Price and Shannon O'Kelly talking about metabolic syndrome on Como.
Well, Dr. Price, wow, fascinating information. You know, if you think about it, indigenous people years and years ago, that's what they did. They took natural products and made medicine. And that's kind of what you're doing. But there's so much more information and research, as you described, and being a biochemist before. You have a real good start to it. But in your practice, you're practicing today as a naturopathic physician. What's your focus? Aren't you doing a lot in metabolic syndrome?
I am, and that also came in a circuitous way as well. So my specialty is complementary cancer care. I work with cancer patients and also oncologists in the cancer teams, and also blood sugar regulation, and of course women's health. And there's some other things in there. But what's been interesting is that I've seen a lot of women, and this comes back to blood sugar regulation. But I've seen a lot of women. Here's a picture. Just paint a picture for people who are listening. 48-year-old woman is exercising 2 to 3 hours a day. She's not losing any weight. Her blood pressure's inching up. Her cholesterol is inching up. And then she's also got a number of other little symptoms that she says, it's hormones or it's aging. This is the way it's got to be. Well, what I've seen and what I know is that is a real good painted picture of what's called metabolic syndrome. It has to do with blood sugar regulation and insulin resistance. Right. And it has a lot to do with stress. And so we all know that with stress, there's also stress hormone cortisol that's made.
Right.
And the cortisol has an interaction on the ability of tissues or cells to receive the glucose or to be stimulated by the insulin. And so that's what we're talking about. And so women and men get really, really frustrated, and they're resigned to say, well, this is how it's going to be. Well, this is why it shouldn't be like that. First of all, you don't feel good, right? And secondly, metabolic syndrome is a risk factor for cancer.
Oh, okay.
And it's also a risk factor for diabetes and other chronic illnesses. And so we've got to reverse that. We can't just kind of lay on our laurels and say, well, it's aging and I'm just going to age. It's a signal. It's a signal to our body that we have to do something about it.
Metabolic syndrome, are you just not able to burn that sugar that's in your bloodstream, or are you just not using it properly?
Well, what I tell patients is that when we're on the planet for a while and we're sedentary and we have a high level of cortisol happening in the body, the muscle cells, pretty much the old muscle cells go, I'm not doing anything. And so what we have is insulin resistance. So higher amounts of glucose around. We have adipose or fat tissue that sticks around, especially around our bellies. We have dysregulation in cholesterol, and so then we get higher levels of hemoglobin A1C. We get higher levels of insulin in the body, and we have this whole sequelae that happens. Yeah.
It's a very complex situation. Metabolic syndrome. If you want more information, how would our listeners get a hold of you?
Yeah, I am at www.drlisapriceND, like Nancy, ND.com.
Well, thank you for your time. It's a half a day topic or a whole day topic, and we did it in 8 minutes, so thank you.
Thank you so much.
All right, that's been Dr. Lisa Price talking about metabolic syndrome. She's a naturopathic physician and culinary nutrition during cancer treatment through survivorship, metabolic syndrome, women's health. It's a wide-ranging topic, Shannon, and we're glad we got to talk a little bit about that with her.
Not only is she a naturopathic physician, but she's also started in biochemistry. What a good combination. And naturopathic physicians, more and more people are seeking treatment from them.
All right, you can get more information, drlisapriceND.com. Back with our final segment after this on Como.